Welcome to the YouTube channel Dr. Mai, sharing medical knowledge. In today's topic, we're diving deep into shoulder pain, a common health concern that can significantly affect your mobility and quality of life. Your shoulder is essential for countless daily activities, making it vulnerable to injury or discomfort. We'll explore the anatomy of the shoulder, possible causes of pain, warning signs, treatment methods, and how to prevent future issues. Don't forget to subscribe to our channel, like this video, and leave a comment with your thoughts or questions to support the channel and encourage more helpful content. What is shoulder pain? Shoulder pain refers to any discomfort or aching sensation in or around your shoulder joint. Since the shoulder allows you to move your arm in multiple directions, it's essential for tasks ranging from reaching, lifting, or throwing a ball to simpler activities like scratching your back or giving someone a high five. Because it has such a wide range of motion, the shoulder is more prone to injuries and degenerative conditions that can lead to pain. What does shoulder pain feel like? The symptoms of shoulder pain can vary significantly based on the underlying cause. You might experience aching or throbbing pain when at rest or in motion, weakness in the arm, making it difficult to lift or hold objects, stiffness that limits your range of motion, popping or clicking sounds during movement, soreness in the muscles around the shoulder. If the pain is due to an acute injury, you might experience sudden and sharp pain, swelling and bruising around the joint, limited mobility, making it hard to move your arm, pain that worsens over time, discomfort that disrupts your sleep. Anatomy of the shoulder. The shoulder is a complex joint that provides an extensive range of motion but requires multiple structures working together to remain stable. Key bones of the shoulder. Key bones of the shoulder: humerus, the upper arm bone, scapula, the shoulder blade, clavicle, the collarbone. Key joints in the shoulder. Glenohumeral joint, where the top of the humerus fits into the socket of the scapula. This is the joint responsible for the shoulder's wide range of movement. Acromioclavicular joint, where the clavicle meets the scapula at the top of the shoulder. Soft tissue components. Rotator cuff, a group of muscles and tendons that stabilize the shoulder joint. Labrum, a cartilage ring that deepens the joint socket and adds stability. Bursa, fluid-filled sacs that cushion the joint and reduce friction. Acromion and coracoid process, bony projections that serve as attachment points for ligaments and muscles. What causes shoulder pain? Several medical conditions and injuries can result in shoulder pain. Some common causes include 1. Arthritis. Osteoarthritis, wear and tear of the joint cartilage over time. Rheumatoid arthritis, an autoimmune condition causing inflammation in the joints. 2. Bursitis, inflammation of the bursa, which cushions the joint. This can occur due to repetitive motions or overuse. 3. Rotator cuff injury, tears or strains in the rotator cuff muscles can result from repetitive overhead motions or trauma. 4. Dislocated shoulder, occurs when the upper arm bone pops out of the shoulder socket, often due to injury or a fall. 5. Frozen shoulder, stiffness and pain caused by scar tissue forming in the shoulder, restricting movement. 6. Tendinitis, inflammation of the tendons in the shoulder, often caused by overuse in activities like sports or heavy lifting. 7. Fractures or bone injuries, broken bones in the shoulder from accidents or falls can cause severe pain, swelling, and bruising. Shoulder pain is a sign of other conditions. Heart attack symptoms. While shoulder pain alone is not a typical sign of a heart attack, pain on the left side, especially when accompanied by chest pain, nausea, or shortness of breath, could indicate a heart attack. Lung cancer. Certain cancers, such as Pancoast tumors, located at the top of the lungs, can cause shoulder or upper back pain. COVID-19 and shoulder pain. Muscle aches are sometimes reported as part of COVID-19 symptoms. If you suspect COVID-19 exposure, consult your healthcare provider and take a test. Carpal tunnel syndrome. Carpal tunnel can affect the hand and wrist but may also cause pain radiating into the shoulder if you adjust your posture to compensate for the discomfort. How is shoulder pain diagnosed? A healthcare provider will evaluate your symptoms through a physical examination and may recommend imaging tests such as X-rays to detect fractures or bone degeneration, MRI or ultrasound to assess soft tissue injuries, CT scans for detailed images of the joint. Treatment options for shoulder pain. The treatment for shoulder pain depends on the cause and severity. Here are some common treatment approaches. Non-surgical treatments. Rest and activity modification to avoid further injury. Ice therapy to reduce swelling. Non-steroidal anti-inflammatory drugs for pain relief. Physical therapy to strengthen muscles and improve flexibility. Chiropractic care to align joints and relieve discomfort. Surgical treatments. Arthroscopic surgery to repair damaged tissues. Shoulder replacement surgery for severe arthritis or joint damage. Self-care and at-home remedies. You can manage mild shoulder pain at home by following the Rice method. Rest your shoulder to prevent further injury. Ice the area to reduce swelling. Compression with a bandage to limit swelling. Elevation of the arm to reduce discomfort. How to sleep with shoulder pain. Sleep on your back with pillows to support your affected arm. Use a memory foam pillow to keep your neck and shoulders aligned. Avoid sleeping on the affected side to prevent worsening the pain. Preventing shoulder pain. Warm up and stretch before sports or physical activities. Use proper techniques during workouts and sports to avoid strain. Listen to your body and take breaks when you feel discomfort. Wear protective gear when engaging in high-risk activities to prevent injuries. When to see a doctor. Seek medical attention if you experience severe pain and swelling. The pain persists for more than a few days. You notice a limited range of motion. You experience difficulty breathing along with shoulder pain. A note from Dr. Mai. Shoulder pain can be disruptive and frustrating, especially if it affects your ability to perform everyday tasks. A proper diagnosis is crucial to finding relief and preventing long-term complications. If you're struggling with persistent shoulder pain, don't hesitate to seek medical attention and follow your treatment plan carefully. Thank you for watching. Don't forget to subscribe to the channel, like this video, and leave a comment below to let us know what topics you'd like to see next. Your support helps the channel grow and brings more educational content your way. By following these recommendations and understanding the causes and treatments for shoulder pain, you'll be better equipped to maintain your health and well-being. Stay safe, and see you in the next video on Dr. Mai, sharing medical knowledge.